Thank you very much. I hope my microphone is on. Everyone hear us?
No.
How about that? Yeah. Okay. That's better? Yeah. Okay, good. This is one of those wireless mics, and you don't know all the time that it's on. Thank you for being here. First of all, let me apologize. I'm late, and you were either real early, on time, or not as late as I was. So I'm grateful for that. I'm sorry about the delay in starting today. Let me thank you for being here, for taking the time to discuss and to debate and to participate in an important debate about the country's future. There is no issue, no domestic issue, which I believe is more important to the American people than health care. We haven't had, I'm sorry? Oh, floodgate. Okay. Staticky. Aaron, do we have an alternative? Will this work? No? Will that work?
Move the mic closer to the call.
Okay. Let me try to talk loud then for a while. You learn how to do that once in a while. We've had debates about health care before. We have debated this issue for 60 years. Certainly debated the last 15 years. I believe it's time to do something about it. Instead of just talking about it like we've been talking about it for a lot of years. We have a lot of discussion across the country. Some of it heated, some of it too heated, but we've had a lot of discussion. That's really important. I have never seen, I've been a public official or a candidate for 15 years, and I followed politics for a lot of years. I have never seen the American people more engaged in an issue in my life, and that's a good thing. That's a good thing. We should be affirmative about that, even when things get rough, even when we debate. So it's very important, I think, that we recognize the level of engagement and involvement that people have. That's a good thing. Before I introduce our panelists, I want to make another point. I know there are a lot of people out there saying this is a really complicated issue. And it's real complicated, so maybe we should just not do anything about it, or we should push it off. This is a complicated issue, I admit that. But you know what? Everyone here is affected by our health care system. And you're all experts in your own ways. You have expertise on the issue of health care that you may not even realize. Everyone here has dealt with a hospital and a health plan and a doctor or a nurse or some part of our health care delivery system. And there are a lot of things to be very positive about. We've got a lot of things going well in our health care system. But we also have a lot of problems, and we've got to solve them. We've got to solve them. We can't just say, well, let's just not do anything, because the problem here is way beyond the issue of health care. We have a fiscal problem here that we have to begin to deal with, like the national debt. If that's all you care about, if that's all you care about, you should be very much, as you have been, engaged on health care. But it's not only a fiscal problem, there are also all of the health care aspects of it that we will talk about today, or at least try to cover as many as we can. So let me thank the Community College of Allegheny County. Let me thank Dr. Johnson and all those who made this possible today. Let me thank you again for your attendance and your participation. Here's what we're going to do. I've got two people to my right.